Hello, my name is Leah Grew, and my presentation is about e-cigarette use while pregnant. Today I will be discussing the special population of pregnant women that smoke and/or use e-cigarettes during their pregnancy. Cigarettes are the most commonly used tobacco product reported during pregnancy, followed by e-cigarettes. There is significant evidence suggesting that pregnant women are using e-cigarettes to try to quit smoking or as an alternate to using tobacco cigarettes. In a study conducted on women's use of tobacco products or e-cigarettes of about 20% of the users, 5.62% used tobacco cigarettes, 6.52% used e-cigarettes, and 8.54% used both. The majority of e-cigarette users reported switching to e-cigarettes when they learned they were pregnant. The public perception of smoking e-cigarettes during pregnancy is widely distributed. Healthcare professionals and patients who are smokers are given differing perspectives regarding the use of cigarettes and e-cigarettes that sometimes contradict each other, and this causes a lot of confusion for the patients. Government regulations do not always agree with each other. From country to country and region to region, there are many differing policies and perspectives and opinions based on research, clinical trials, and literature reviews that do not always agree with each other. It is generally not recommended to use e-cigarettes as a smoking alternative when pregnant. However, it is considered less harmful to the fetus and the pregnancy. But the issue here is still that it is causing harm to the fetus. Generally, people believe it is a healthier alternate to smoking real cigarettes. There are many differing perspectives which cause controversy in public perception. Overall public perception is that it is not as bad as using real cigarettes. From a healthcare standpoint, however, using e-cigarettes is less harmful but still quite toxic to both the mother and the baby's health. Some differing perspectives include, in the United States, the Surgeon General report states that nicotine-containing e-cigarettes are unsafe for pregnant women. The US CDC also agrees that due to unproven safety and efficacy, they should not be considered safe to use in pregnancy. In New Zealand, however, no e-cigarette has received regulatory approval, and they are classified as medicinal products there and not even recommended for use in smoking cessation. In Canada and Australia, there are no recommendations for e-cigarette use in pregnancy. And in the UK, major public health organizations recommend e-cigarettes as a part of an overall tobacco harm reduction strategy. There's even an e-cigarette that has been approved for use in pregnancy in the UK based on clinical studies, but this e-cigarette, called the Evoke, does not even have any study done where specifically the effects on pregnancy were studied. So there's a huge problem here. Pregnant women are a very vulnerable population. These women are in a time where they're starting a family and beginning a new and changed life. Preparing for a pregnancy is often very expensive. Many women are willing to stop smoking and turn to using e-cigarettes instead of investing in pharmacotherapies. E-cigarettes provide an alternative which could be a factor for low-income individuals as compared to investing in pharmacotherapies, which are way more costly. There is also less stigma associated with using e-cigarettes rather than real cigarettes. E-cigarette companies are very smart in marketing these products. They're using words like alternative and to quit smoking and healthier as ways to attract consumers. Their ads target young smokers, emphasizing that they will gain independence and maturity when using these products. What makes the e-cigarettes very appealing is that they are readily available, widely marketed, and there are more than 7,700 flavors. Nicotine is a known teratogen, which is linked to preterm delivery in animal models, and this is consistent with human studies of smokers and offspring. Most e-cigarette liquids contain nicotine, and it is a known fact that nicotine penetrates the placental barrier and accumulates in the fetus at levels similar or higher to the mother. Nicotine exposure affects fetal development in the immune system, neural development, lung function, and cardiac function. In multiple studies, it has been shown that the flavoring additives are very toxic. Flavoring additives might be approved for oral consumption, but they're not safe when inhaled. Cinnamon e-cigarette flavors have shown to be extremely toxic in multiple studies done on e-cigarette refill fluids. The World Health Organization and national health agencies warn women against using e-cigarettes in pregnancy. From a human rights perspective, it is an ethical and legal obligation to communicate potential risks and uncertainties associated with e-cigarette use in pregnancy to healthcare providers and pregnant women to provide pregnant women with safe, evidence-based treatment. If healthcare professionals cannot give informed and unanimous advice to their patients, then the quality of care goes down, and patients can't receive accurate information to make informed decisions about their health. Our discussion questions are 1. What would be some beneficial ways to educate patients about the dangers of smoking e-cigarettes without causing them to feel guilt or shame? And 2. From an international human rights perspective, what do you believe can be done to overcome the discrepancies regarding smoking cessation recommendations to use e-cigarettes instead of cigarettes in pregnancy?